share with students who might be interested in the, getting involved in speech language pathology. We haven't had any at this point, but I think it's something that we could probably focus a little bit more on for our students.
Excellent. Good.
And Danielle, that's exactly, and I'm not, if anybody else wants to add, that's great. But obviously we know that people probably have already gone through the unit on exploring health professions and exposing young people to all the opportunities there are in health science. So we hope that teachers will go back and use this webinar, like you said, in the beginning, because that usually is a kind of a unit that's early in the curriculum design. And so it'll be this will certainly be recorded and available for teachers to use next school year.
Nancy, I think one thing that I was kind of hoping for was when we do talk about communication, how can we better explain to our students, patients that have had strokes or TBIs, the aphasia that they can go through or experience and the frustrations that they may have? How can health professionals better communicate with those patients?
Okay.
So is it more of the interprofessional practice? So helping the other professionals, or?
Well, helping other professionals, but then also communicating better with that patient to decrease their frustration.
Mm-hmm. Let me make a note.
And then also to the student on, don't do what I'm doing and participate in webinars while driving.
I'll make note of that for when I get my license.
God. Sorry, she's not being a good role model today. Okay. Well, just don't text. Just don't enter anything in the chat, young lady. Young lady being you, Karen.
I am young. I am 25 for the record.
Okay.
And I'm not, you know me, I'll just unmute and ask it.
Okay. All right. Well, I'm letting, let's see, I have two people we're letting in, and then we're going to get started here. And I'm already recording, Laura, so you can take that off your to-do list. Okay. All right. Well, welcome everyone. My name is Nancy Allen. I serve as Executive Director for the National Consortium for Health Science Education. This is our last Wednesday webinar for this season. We've been busy providing these quick 1-hour professional development opportunities since August. And we usually do 2 to 4 of these a month. And we're happy to connect with classroom teachers, and in this case today, even a student. And we're just committed to providing meaningful professional development that will support you in the classroom. So we will resume these webinars in August, which is not too long from now, but hopefully you have a summer break planned. So we'll be back at this again in August. And we know that we are looking to provide a new teacher seminar, and that will be longer than a webinar, but that will probably be in early August. So that'll be announced here on our website. And it's going to be for new teachers, but I suspect that new teachers sometimes think they're still new after 3 years. So we're looking forward to providing that support. We also will be releasing a new resource. It's a revised resource. Our work-based learning guide had been around for a while, still had some wonderful content, but it just needed some revisions and technology added. And so that is with the developer now and will be released in August. So we'll have a webinar in early September highlighting this new resource and how you can integrate it into your health science education program. And then lastly, I just wanted to say that we are planning our National Health Science Conference, and we'll be, and this is just a copy, or I guess a link to the registration, which will be available on our website tomorrow. We're encouraged that there will be some teachers that will be able to travel. I was telling Judy, our presenter, I got a call today from someone in Maryland to say, I'm trying to register 2 teachers for your conference. You know, I just about jumped through the phone. I get so excited. So we're moving forward with hope and positivity that we'll be able to have this conference. There will be a hybrid portion of the conference. So for those teachers that are not able to travel, there'll be an online opportunity as well. Just wanted to remind you, if you're interested in professional development, documenting 1 hour of professional development, you can email us. It was in the email that you received today in that message. That you can email us and we'll send that back out to you in about a week. Certificate of participation for 1 hour. And then I'll put the email in the chat as well, but you have it in your message. And then leading up, I just wanted to thank Judy Blackburn. She was actually our first Wednesday webinar about 3 years ago, and she did a similar presentation, and it was outstanding. Her videos are amazing, and I think you will really enjoy what she has to say. She represents the American Speech-Language Hearing Association, and she is a member of the board of the National Consortium for Health Science Education. And she's a part of our professional associations membership category. And they really are interested in knowing about your students and also providing resources and engaging with you to showcase audiology and speech pathology to your students. And we just feel like these careers are out there, but our students don't always know about them as much. And so we love having relationships through our organization with these professional associations like the Dental Assisting Board and also Pharmacy Technician Certification Board. And we have the American Medical Technologies Association. So Judy's in that category. And to their credit, they probably are our longest partner in that category. So Judy, it is my pleasure to give you the microphone and just thank you so much for your willingness to do this today.
All right, fantastic. And we're thrilled to be able to present. I'm going to go ahead and share my screen. And hopefully everyone can see this. I'll go ahead and start the slideshow. So welcome. We are going to be talking about 5 surprising facts about audiologists and speech-language pathologists. And for those of you who have some experience in the profession, it may not be so surprising, but I know when I first became a speech-language pathologist, I was kind of blown away by all the things that we did. So hopefully this will be something that will intrigue your students, make them interested in both of our fields. And I am an Associate Director of Academic Affairs and Research Education at the American Speech-Language Hearing Association, or ASHA. And yes, if you're looking at that, language was added to our title at a time after speech and hearing were added, but instead of trying to get people to say Asalaha, we kept it ASHA. So I wanted to give you a quick overview of what I'll be covering. So I'll give you a quick background about me, about ASHA, and I also wanted to give you a heads up that I have resources for teachers and students, and instead of just giving you all of those at the end, I've got them sprinkled throughout the presentation. I'll be talking about professions and what we do. I'll be talking about the educational pathway and job outlook, and not to give it away, but the job outlook is fantastic for both professions. I'll be talking a bit about preparing high school students for careers in these professions, and again, a little bit about the impact of COVID-19. Right, so first, to start off with, let me tell you a little bit about ASHA. So this is the National Professional Scientific and Credentialing Association for 218,000 members and affiliates. And we serve audiologists and speech-language pathologists. But in addition to that, we've got speech, language, and hearing scientists, faculty researchers, audiology and speech-language pathology assistants, as well as students. And we do a lot of different things. So we provide resources, and these are for clinicians, but they're also for related professionals. They're for people with communication disorders and their families. So we have a lot of information that is available to the public, open access. So keep an eye out for that. We have information about disorders, assessment and treatment resources, evidence-based practice data. We publish journals on communication sciences and disorders, and we advocate for members and those they serve. So this is my career path. You might have some students who end up doing this kind of all over the place career path. I was originally trained as a social worker, and I ended up working in a special education school and was honestly getting kind of burned out with the problems that I was facing on a daily basis. And I saw what the speech-language pathologist was doing and was like, that looks good. I want to do that. So I ended up getting my master's degree and then going on for a PhD because I got really interested in teaching and research. And I did research looking at reading and language skills in children exposed to family violence. And I worked as a faculty member for about 7 years at Towson University, and then really missed the clinical work and returned to that at an outpatient clinic, Kennedy Krieger Institute, and then Baltimore City Public Schools. And when I was at the schools, this position opened up at ASHA, which was, again, just perfect fit. And I did want to say one of the reasons I'm so glad to be presenting is when I was in high school, I don't think I knew what a speech-language pathologist was at all. I think it was after I graduated from college that I finally was like, oh, why didn't anyone tell me about this? So I am so glad that we have a high school student who's interested and we have high school teachers who are passing on this information. So I'm going to go give you a definition of each of the professions, just to make sure we're all on the same page. So an audiologist is a healthcare professional who specializes in preventing and assessing hearing and balance disorders, as well as providing audiologic treatment, including hearing aids and cochlear implants. So they work with hearing and balance disorders. So again, one of the things that kind of surprised me when I got into the professions, they work with people across the lifespan, and they work in both hearing and balance areas. Taking a look at speech-language pathologists, they are healthcare professionals who identify, assess, and treat speech and language problems. And we also work with swallowing and cognitive communication disorders. So again, not what I expected when I first became a student, but just the range of things we can do is really phenomenal. So we take a look. One of the things I do like to explain is that we use our terms very specifically, as every profession likes to have their jargon, likes to have their own special vocabulary. So when I talk about speech, I mean the physical production of sound. So how you make the sounds, fluency, how your voice quality works, that's speech. And language is understanding what people are saying and then figuring out what you want to say. Swallowing can also address feeding issues for both adults and kids. And when we talk about cognition, we can work with people who have dementia, or also just people who are working through being able to function on a daily basis. And another quick heads up here, the term communication sciences and disorders is something that you'll see a lot on our webpage. And this includes programs in audiology and speech-language pathology. So a lot of undergraduate programs cover prerequisites for both, and they're professions that have been linked in how they developed, and which is why they're under one professional organization. A lot of the departments don't want to call themselves specifically one or the other because they address both. So one of the things students may have some trouble with if they're looking for programs is the departments can have many different names. So these were some of the places where I went to school or worked, and they all had a different name: hearing and speech sciences, speech language and hearing sciences, speech language pathology, and audiology. So it can be confusing for students who are trying to find these programs. So I'm going to introduce you to our first resource. This is EdFind. So this is ASHA's online search tool, and this includes programs in communication sciences and disorders. So this includes undergraduate programs, the master's program in speech-language pathology, the clinical doctorate in audiology, and all the way up through research programs. And there are lots of searches that you can do. You can do online programs. You can look by state. You can look at multicultural emphasis, bilingual emphasis. So again, great resource if you're just trying to figure out, where can I go? What are some options? So we're going to get into the 5 surprising facts. And again, for some of you, this may not be as surprising as it could be. But again, a lot of this information was new to me when I started the professions. So looking at the scope of practice for audiologists, you probably know that audiologists assess and treat hearing disorders, such as hearing loss. But did you also know that audiologists assess and manage tinnitus? So that's a ringing in the ears, and also balance disorders. And so one of the groups that audiologists work with is veterans, and they may have tinnitus due to noise exposure like gunfire and explosions. They can also have vertigo from any kind of head injury. And so audiologists will collaborate with doctors and physical therapists when working with veterans. And I have to admit, when I was looking up some of the things to include for audiology, there's quite a bit of overlap between audiology and speech-language pathology, but also quite a bit that's different. And I wasn't entirely sure what vertigo meant. I knew it was something about dizziness, and I knew that I didn't want to come to this presentation and not know my own terms. So here's my second resource for you. This is the practice portal at ASHA's website. And this includes information for all types of disorders. It includes information on professional issues. So if you have a student who's interested in learning about a particular disorder, maybe they've got a family member who's had a stroke and they want to find out what we're working on, what these terms mean, you can go to the practice portal. It is, again, public, open to everyone. It includes definitions. It talks about prevalence and causes, and what types of treatment you may do. And it has references and resources. And also a great resource for teachers if you're interested in doing any kind of presentation on one of these disorders. So I did look up vertigo, and it refers to dizziness or a sense of spinning or loss of balance. So I checked it out. So fact number 2, what audiologists do. And you probably know that audiologists fit and program hearing aids. But did you also know that audiologists collaborate with surgeons and families when a child receives a cochlear implant? So I don't know if any of you have seen those videos where they have a baby or a very young child who's just gotten the cochlear implant and they're hearing their parents' voice for the first time and everyone's crying and the kid is lighting up and what's that? What's that? Usually the other person in that video is the audiologist. So it's the audiologist who, once the cochlear implant has been put into the child's head, then they will be doing the mapping and the activation of the cochlear implant and making sure it works and all of the correct frequencies have been stimulated. So go audiologists. That's one of my favorite videos to go on YouTube and watch. Okay, and this is our third resource. We have a series of videos with audiologists and speech-language pathologists talking about their profession. And these are each about a few minutes long. So again, really nice to just, you can show this really quickly. So let's get started with the first one.
Gadson. getting to see the children grow and being able to see how their language is developing from infancy when they first come in to when they leave in the 3rd grade. They're just chatting away, and most of these parents maybe didn't even think that that was possible. So when you get to have a conversation with a child who was born deaf, that's just amazing, and it's so rewarding to know that I'm part of that process. My name is Julie Martinez Verhoff, and I am the Director of Audiology at the River School in Washington, D.C. As a mentor, I train doctoral students in audiology. Currently, we have a doctoral student named Jennifer who is really great. She was diagnosed with a hearing loss when she was 5 years old. The students love when they come into the clinic and they see Jennifer and they see her hearing aid, and they'll be like, "You wear a hearing aid, so do I." You ready? It's going to be on your left side. It's so rewarding to see the children here is once they get to the final grade, to that 3rd grade, and they leave and they're mainstreamed. That's amazing that they can go to the library and get a book by themselves, that they can pick up the telephone and talk to their friends, and these children can do that. They can sing, they can play the violin. These are all exciting things, and audiologists are a part of that.
All right, so moving on, this actually leads me into my 3rd fact, where audiologists work. And if we were doing this in person, I would send out a question to everyone: where do you usually think of an audiologist working? And my impression is a clinic. You know, that's people go to a clinic, but audiologists work in hospitals, they work in schools, and of course, now you know they work in schools. We just had a video on it. They work at universities. A good percentage of them work in private practice. They do home health, and they work in outpatient rehabilitation facilities. So again, just wide variety of places where audiologists are working. This is an example of one thing they might be doing in the schools. So if a child has a hearing loss and has a hearing aid, classrooms can be really noisy places. I'm sure that's not a shock to anyone. So it can be really hard for, you know, even when there's a typical level of noise, students participating, it can be really hard for a child with a hearing aid to even be able to figure out who's talking. So an FM system is like a personal radio that the teacher wears a microphone, the child wears a receiver, so they're getting that message from the teacher directly. And this is something that an audiologist can help set up and manage any problems with. And this is just a quick overview looking at where audiologists work. The majority of them are in outpatient clinics, home health, and private practice. You can see a good percentage working in hospitals, but we also have a good percentage working in schools or at the college and university level. Great, fact number 4, who audiologists work with. And you probably know that audiologists work with older adults and children, but audiologists work with people through the entire age span. Again, one of the things that I thought was really intriguing when I first started is that there are now methods to measure hearing in newborn babies. So they, you know, if you have someone who cannot raise their hand when they hear the beep, we have a lot of different methods for being able to test hearing so that you don't miss a hearing loss in very young children. Audiologists also can work with young adults with traumatic brain injuries. And as we talked about before with veterans, this can impact balance and hearing. So if someone has been in a car crash, I think often people will think of, oh, well, first they need to be able to walk again, they need to be able to talk again. And sometimes people don't realize that part of walking is balance, part of communicating is hearing. So of course, these are things that are also wrapped into that treatment. So fact number 5, disorders that audiologists address. And you probably know that audiologists work with adults who have hearing loss due to the normal aging process. But did you also know that audiologists work with people who have hearing loss due to many other causes? So one possibility here is there are drugs for cancer treatment that are ototoxic, which means that they can actually damage the hearing system. So if someone is being treated for cancer, of course they need to these drugs, but it's one thing where they may have to consult with an audiologist and be on the lookout for this as something else that could happen. Audiologists also work in industry to help prevent hearing loss in the workplace. And my little icon there is a factory, but it could be an office building, it could be a classroom. So they can measure noise levels, they can make recommendations for how to alter the environment to make it less noisy. Sorry, they can't do anything about students talking. That's on you. But just things like teachers put the tennis balls on the bottom of chairs so they don't make as much noise. Those are some very simple things that you can do as strategies. We have our second clip. So this is an audiologist working in a private practice. And one of the things I really like about this clip is she really talks about the wide variety of things that she sees on a daily basis.
Okay. This is not a math test, but just go ahead. The beginning part is... Being an audiologist is fun, rewarding. It's challenging. If you like problem solving, if you like working with people, it's an excellent place to be. My name is Chizuko Tamaki. I'm an audiologist of Professional Hearing Services in Falls Church, Virginia. On a normal day, I may be seeing a 4-week-old baby, doing a hearing screening on them or diagnostic testing on them. I could be seeing a 99-year-old coming in for a hearing test and hearing aids.
That causes me great discomfort.
This patient is coming in for dizziness and balance evaluation. So we're going to be doing a hearing test, and then we're going to be doing what we call video nystagmography, or VNG. It's got infrared cameras inside. I always try to explain what's going to happen, what goes on, because that also eases their tension, and also they feel more comfortable with what they're going through. Eyes wide open for me. We're going to be looking at her eye movements as we put her head into different positions. And we're also going to be looking at her eye movements when we artificially stimulate her inner ear balance organs. Can you hear my voice okay? In about 5 years, I probably want to ramp up my career to either a different direction or just at an advanced level. But I don't feel like I'm limited because there are so many other opportunities in audiology. I could be doing more research. I could be teaching full-time. I could be a director of some audiology clinic. There's so many opportunities there.
And I did want to also mention here, you saw all the cool technology. We do a lot of research in collaboration with engineers. So if you have students who are really interested in building things and seeing how things work, some of the people I know who got into audiology, that was the way that they actually got into it and were intrigued by that process. All right, so now we're going to move on to 5 surprising facts about speech-language pathologists.
Judy, maybe before we go, could I just ask a question? All audiologists are doctors of audiology? That's the entry?
Yes, so the entry-level degree for audiologists is a clinical doctorate, which is different from speech-language pathologists who it's a master's degree.
Okay, so do they have like 4 years undergraduate and then a little bit about the educational, how that connects?
Sure, and I've got that in the video, but if
okay,
it's...
that's fine. That's no problem. Just we can hold.
We'll get there, yes. Thank you. So much to talk about, yeah. So taking a look at the scope of practice for a speech-language pathologist, you probably know that speech-language pathologists assess and treat articulation disorders, such as when kids say wabbit for rabbit. But did you also know that speech-language pathologists assess and treat disorders in voice and fluency, language, feeding and swallowing, and cognition? And of course, I'm going to say, yes, you know this because we talked about it earlier in the presentation. But to give you an example of some of the things that speech-language pathologists work on, they can work with young children who are not interested in trying different types of food. They can actually work with helping them try different types of food, try new textures. They can work with adults in skilled nursing facilities, collaborating with doctors, dietitians, and nurses to help adults with swallowing problems so that they can eat and drink without choking. So fact number 2, what speech-language pathologists do. You probably know that speech-language pathologists work with people who stutter to teach them strategies for fluent speech. But did you also know that speech-language pathologists work with children in schools on language-based literacy skills and pragmatic skills? So one of the things that a speech-language pathologist might do is work with students on pre-reading skills, like being able to identify sounds and words and blending the words or blending the sounds to form the words. They can also work with students on the autism spectrum with conversational skills. So that's one of those things that I feel like sometimes we take it so for granted. How do you have a good conversation? And so actually breaking it down for a student is one of the things that I did that I really enjoyed. And how do you, because being able to have a conversation can be such a basic skill for making friends and keeping friends. Right, and this is our first video for a speech-language pathologist. And one of the things that I like about this one is that I think we think of speech-language pathologists working in elementary schools, and we don't always think of them as working with middle schoolers and high schoolers, but that's definitely part of what we do.
The thing that's most rewarding about being a speech-language pathologist is getting to work with the adolescents that I see every day, to be challenged by them, to be inspired by them, and to help them learn to be successful. I'm James Brinton. I'm a speech-language pathologist at the Catherine Thomas High School in Rockville, Maryland. I'll read it. I want you to follow along. I chose to work with high schoolers with moderate to severe learning disabilities because I realize it's very important for them to have the skills to transition out of high school into adulthood. I work with a social worker for each student. I also work with an occupational therapist and a school psychologist. We come together to collaborate on the goals that the students have. The American Speech-Language Hearing Association supports me in 2 ways. They provide scholarly articles for me to read as I research about my clients, and they also keep me connected to other professionals in my field in different settings, such as a hospital or a clinic. This is what we did before for open mouth. So with the experience that I've gained here, I hope to get a strong clinical foundation and either someday open up my own speech practice or return to a university to teach and supervise clinically. I love working with the students. They challenge me and inspire me every day. I love the support staff and the school, and I think being a speech-language pathologist is a great career. At the end of a workday, I definitely feel like I've worked hard. I have a sense of fulfillment knowing that I've improved students' lives, and I look forward to the next day.
And one thing I also wanted to say here, he mentions working with other professionals in interprofessional practice. In one of the schools that I worked with, I remember working with a really, really challenging child. And finally talking to the teacher about what were the best ways she knew to connect with him, because he was really difficult and it was hard to develop that rapport that we kind of, again, take for granted. And she had wonderful suggestions. I ended up using them and was finally able to really connect with the student. And I felt like, of course, I should have gone to the teacher right from the start. But I think that's one of those things where we so help each other out. So I could also come with, these are the things he's going to have problems with if you're talking to him, or give you directions. These are strategies for that. She was also so incredibly helpful with being able to connect with this student. So taking a look at where speech-language pathologists work, we already talked about them working in elementary schools, but just like with audiologists, they work in hospitals, they work in home health, private practice, universities, and outpatient clinics. So some of the things we do for home health services, you might be working with an adult who's experienced a stroke, or has some kind of progressive neurological disorder. So you can work on cognitive skills so that they can stay at home and they can be safe at home. Early intervention services can include working with families to help toddlers say their first words and first sentences. And that's something that I also did and absolutely loved. So this is, again, taking a quick look at where people are working. Majority of speech-language pathologists do work in the schools, but about 40% of them also work in healthcare. So lots of choices for students thinking of where they would like to be working. So fact number 4, who speech-language pathologists work with? And again, you probably know that speech-language pathologists work with school-aged children, but just like audiologists, they work with people through the entire age span. So they could be working with babies in the neonatal intensive care unit, working on swallowing, working on being able to nurse, being able to get sustenance. They can also work with preschoolers to help them expand vocabulary, improve their comprehension skills, being able to follow directions and answer questions. And they can also be working with veterans who've received head injuries to help them recover both receptive and expressive language skills. Right, and this is a school, or sorry, not a school speech-language pathologist. This is someone who is working in early intervention.
I chose to work with young children because throughout my career I've worked with birth through elderly, but it's the younger population, the infants and toddlers, where I get more joy because it's the developmental stages and I'm making an impact that will last throughout their lives. I'm Charles Coward, a speech-language pathologist and manager of Connections Therapy Center. I'm a speech-language pathologist because I love working with children. I love seeing children grow and change, and speech-language pathology is very important because everyone has a right or a need to communicate. Donovan is a wonderful little boy with a bubbly personality, and inside of him, there is the ability to communicate more consistently, and I'm just trying to find out which door I have to unlock in order to open so that he can communicate effectively and efficiently every day. In Donovan's session today, since he's a nonverbal child, we're working on getting him to consistently use the sign for please and teaching him the sign for apple. Now let's go for apple. Good. To see where he came from and what he's doing now and what he has the potential to do is just remarkable. In the future, I can see myself working in theater or film, teaching actors ways to improve their articulation. And with more training, I can also be a dialect coach to teach the dialects for character development.
All right, moving to fact number 5, disorders that speech-language pathologists address. And we've already talked about the fact that speech-language pathologists work with people who've experienced a stroke, but they also work with people who have a progressive neurological disorder. So for example, they might work with people who have Parkinson's disease and help them be able to articulate and speak more clearly. They also help patients with Alzheimer's disease stay oriented, and they can help families structure the environment so that people are able to stay home again for a longer period of time and actually help people with memory and attention. And this is, this one always makes me feel especially happy. She was my student when I was at Towson University. So here's Davetrina.
I became an SLP because I knew that there was diversity in this field, and I knew that I would have the opportunity to help people communicate. 8 years now in this profession, I wouldn't have it any other way. My name is Davetrina Seles Gadson, and I am a speech-language pathologist. One thing that I really enjoy about my day is that it's definitely not routine.
You'll say them and then I'll repeat them after you.
From working with patients with voice disorders to neurological disabilities and speech to swallowing. Sometimes it might include community outings or working with other therapists to make sure that we're treating the entire patient. One of the most exciting experiences that I've had is working as a travel SLP. I've lived in Chicago, I've lived in Dallas. So just having that opportunity as well as building my career is something that this field has afforded me. My patients inspire me. They have a magnificent ability to be resilient. So Tajay is a 19-year-old college student who had a brain tumor. One thing that prompted this type of outing is that Tajay expressed that she likes to eat out a lot, but friends and family were ordering for her because of her fear of not being understood. So today was a perfect opportunity to take her out, have her order for herself, and build that confidence that she is intelligible and people understand her. Knowing that Tajay is so close to returning to college and the community is such a rewarding feeling that it's hard to put in words. She is an amazing person, and to have met her at this junction of her life is, I think, more beneficial to me than her. Yeah.
All right, so we are going to move now into looking at the educational pathway and job outlook for both of the professions, starting with audiology. So as I mentioned before, a clinical doctoral degree in audiology is required to work independently. And this usually takes about 3 to 4 years of full-time study after a bachelor's degree. And one of the reasons why it's longer, there is a clinical fellowship period of time that both audiologists and speech-language pathologists do if they want to get certification from ASHA. And so for the AUD, that is included as part of the degree. And for the master's degree in speech-language pathology, people do that after they graduate. So that's one of the reasons why the time frame is different. And this is one of the questions I get a lot is, I didn't go to an undergrad program in CSD. What can I do? So I'm going to give you another look at EdFind. So again, love EdFind, very helpful. So there are a good percentage of programs that don't require that you have an undergraduate degree in CSD. And so you can use EdFind to search for programs where the prerequisites are not required for admission. You can actually also search for programs that offer prerequisites and you don't have to be enrolled. And you can also take some of them online. So that is one of the pathways. It would probably take a little longer if you're entering a program where you're taking those courses as part of the graduate program. But again, it gives your students more options. So job outlook, everyone's interested in money. It's important. So the median salary for audiologists is $81,000. And this is coming from the Bureau of Labor Statistics. And the job outlook is very good. So even in the midst of an economic downturn, we are still seeing over the next 10 years that they're predicting a 13% increase in job openings. And just to put this in perspective, this is information for other types of jobs. So across all occupations, they're predicting a 4% increase. Across all healthcare professions, they're expecting 10%. And so then we have audiology at 13%. And I love graphs that work out so nicely like this. So looking at the master's degree for speech-language pathology, this usually takes about 2 years of full-time study if you have the undergrad degree. It can take up to 3 if you take it as part of the program. And again, that's something that's offered as part of the speech-language pathology degree. And this is what I did. So I came from a social work background, did not have, had some of the prerequisite courses, and I'll be talking about those a little bit later, but I needed to take more. So I was really happy that I could just jump right in with the grad program, or I could take the prerequisites as part of the program. And I'm also going to take you a few more things with EdFind. You can also search for programs that have part-time options. And we also have some programs that the entire degree is online. So these programs, students will usually find clinical placements where they live, but the academic coursework is all done online. So that option is available. The median salary for speech-language pathologists, very similar to audiologists, around $80,000. And you also see a big increase in job openings predicted over the next 10 years or so. So 25% increase in job openings. And again, I love making tables with bright colors that shows how great our professions are doing. And one of the things I also throw out there is I still get cold calls from contract companies offering positions. And it's really nice to be able to say, no, I'm good. I really love where I am. But also just, again, really nice to know that the jobs are out there. And I'm going to talk a little bit about audiology assistants and speech-language pathology assistants. So these are people who work under the supervision of an audiologist or speech-language pathologist. The main difference in the scope of practice is that they cannot diagnose or do independent assessments. So that has to be the clinician who is doing that. But apart from that, they can do quite a bit of the actual therapy provision for the audiology assistants. They can do screenings. They can look at hearing aid preparation. Speech-language pathology assistants can help with bilingual services. So this is another option for students who don't think that they're going to be ready to do an entire graduate program. The requirements vary. This is something that can be a little more difficult because each state determines the requirements for assistants and they can run the gamut. So there are some states that require a high school degree, some that require a training program, some that need a bachelor's degree. So I actually have a link there to the state-by-state requirements so students can check out what is actually required. And states vary by how they regulate. So some states have licensure, some have registration, some don't permit assistants to work, and some don't have any kind of regulation. So it varies a lot state by state. And we do have a list of training programs for states that specifically require that. California is one of the states where they do have a lot of training programs. And we are very excited because ASHA in 2020 started a certification program for assistants. So this is something that's establishing educational and clinical experience requirements. There are different pathways that applicants can explore. There are options for active duty military and veterans. So this is a really nice option and hopefully a way to make some of the requirements a little more consistent across states, though the states are going to have to accept this as one of their qualifications. Okay, so we're going to take a look at preparing high school students. So if you do have students who are really interested, what should they be taking? How can they start to prepare for that starting in high school? So these are undergraduate prerequisites required for the master's degree. And audiology students will often have very similar type prerequisites, though it's more determined by the program. So they need, and this is what they need as part of their undergraduate requirements for taking them before the master's. So statistics, biological sciences, social behavioral sciences, and physical sciences. And again, for when I was looking into this, I met a lot of those requirements just with a general college degree, but programs may also have specific requirements for things like child language development or phonetics, and those were courses that I did need to take in addition. So other related coursework and volunteer experiences, if the high school has a child development lab, I know when I was in high school, they had a part-time preschool and students volunteered and worked in that as part of the coursework. Bilingual clinicians are in high demand. So strongly recommend a foreign language course, math and statistics. You'll be doing research design as part of your graduate work. So anything that starts to prepare students for those types of experiences is fantastic. And I'm going to move into looking at the impact of COVID-19 on academic programs. I'm trying to keep an eye on the time, so I will probably do this part a little more quickly. So we actually do a yearly survey of academic programs, and this year we asked them additional questions about COVID-19. So these were challenges that the programs reported, and the number one challenge was clinical education and making sure that students got the clinical experience that they needed. So with a lot of the closures and lockdowns, a lot of the healthcare settings could not accept students. So programs were very creative in doing telepractice and using clinical simulations and setting up their clinics so that they were safe. So that has been something that programs have really done some remarkable work in making sure that their students get the clinical experience that they need. So looking at student graduation rates, there were some students where graduation was delayed because they're still trying to get some of these clinical education requirements. But the majority of programs graduated students on time, which again, I would thought was pretty impressive for that last spring when people were really, you know, this was a very quick, sudden change for many programs. And then looking at enrollment for fall of 2020, again, some programs did experience a drop, but a good, oops, sorry, I moved before I meant to. But a good percentage of programs are showing either expected enrollment rates or some of them are showing increased enrollment. And I think a lot of students ended up maybe choosing to live close to home and go to the program that is close to their home instead of going somewhere else. And one of the other things about COVID-19 to consider is that we're now seeing a new population of people who have recovered from COVID-19. And we're seeing a lot of long-term effects that speech-language pathologists will probably be working with. So strokes have been linked to COVID-19. So working on speech and language skills after a stroke. When people have been on a ventilator, that can, of course, interfere with communication. And while they're on the ventilator, the speech-language pathologist can actually be helping with how do I help them communicate if they can't speak. You may also see people having more cognitive problems, again, more long-term effects, and swallowing problems associated with if you have a ventilator, once it's taken out, there's usually some impact on the vocal folds. And so that can be something where the speech-language pathologist can help with swallowing. So, and this is a listing of the resources that I talked about: Practice Portal, EdFind, some assistance information. I also have information, our main webpage for students. We have brochures that you can order, career guidance tools. So this is something that teachers can also explore and access. We have data about the professions. We have data about academic programs. We have so much data. And CIDCAS, when students are ready to apply for graduate programs, this is one option. These again, I just have included these links. I can also, I wasn't sure if I can send a PDF copy of the presentation so that if you want to access some of this information, some of these links, that information is there as well. And any questions?
I think this was a question we talked about briefly yesterday, and we talked about the gender breakdown for audiologist and speech-language pathologist.
And I looked it up, so I wonder if I can access it. This is what you should never do, is experiment in the middle of a presentation. But this is actually the link that I went to find that information. So we do, fantastic, membership and affiliation counts each year. And for audiologists, the breakdown is about 14% male and about 86% female. And for speech-language pathologists, it's about 96% women and about 4% men.
Well, we applaud you for finding those two gentlemen to participate in the video.
I think with many of the health professions, there is definitely that perception that it's women's work and it's everyone's work. But I think that's something that is changing gradually.
Yeah, there may be one profession I think about, dental hygienist. They may have less males than you. I'm not sure. That'd be interesting. I may look that up. Any questions from the audience? Judy is so comprehensive. I'm sorry I went down the educational pathway. I should have known you had that all taken care of.
And I'm going to put my email in the chat as well.
Okay.
In case people would like to contact me, ask questions, I'm happy to talk about educational pathway, happy to talk about different options for the professions, what students need to be looking at.
And I would appreciate it if you could send the PDF of the PowerPoint, and we'll add that along with the recording. And I'm put also in the chat, I put the email address where you can request a certificate of participation, if that's helpful to you, to document your professional development. Judy, thank you so much. Look at you, right at 5 o'clock. You did a great job. And hadn't really even thought about how COVID had affected practice as well as educational preparation. I mean, obviously we had thought about educational preparation, but not really thought about people being on ventilators and just the recovery of that and how your professions are impacted. But we often hear from our health science students, I want to work with children, I want to be a pediatrician. And so I think they will be engaged, thinking about the opportunities to work with young people and babies and just, another. And I put in there, I think you all probably have a little bit better schedule than maybe the ER doctor or the ICU nurse, I mean, I assume you do work some weekends, but not quite as much as maybe some of the other professions.
It's definitely, I think everyone deals with paperwork, whether you're working in the schools, a hospital, rehab center, but there is some flexibility in terms of your hours. I know friends who work part-time, and again, because there is such a high demand, people tend to be more flexible with that than they might be.
Well, thank you, Judy, so much. We appreciate what the American Speech Language Hearing. Oh, and I appreciate you telling me why the L's not in there. I had wondered about that. But we appreciate what your association does in partnership with us. And we appreciate your willingness to provide this opportunity for professional development for teachers. And we hope that they'll be able to use that with their students to highlight the two professions and then the assistant opportunities for those professions as well. Thank you again. Goodbye, everyone. Have a great rest of your day.
Thank you. Thank you.